doctor, with every migraine, there are different stages, right?
Sure.
Is that
Yes,
correct?
that's correct.
All right, we have a graphic here of typical stages of migraine. So let's take them one by one, doctor, and tell me what this person unfortunately is feeling.
Okay, so typically the prodromal stage can start up to 24 hours before you get a migraine, but it's not always the case because some migraines are very sudden onset.
Okay.
Thereafter, the aura is what you may or may not experience along with the start of some of the phases of your migraines in the prodromal phase. So the aura, you might see flashing lights, you could see some bright lights, you could see some, yes, zigzag lines on appearance of your visual. Some patients can get difficulty with hearing, sensitivity to sounds. You can get other different types of auras, but usually typically the visual auras tend to be the most affected. Thereafter leads to the headache. So some of the subsequent symptoms start within 24 hours, but they can start 4 to 6 hours even prior to getting an aura. The headache is a migraine that usually starts very gradually and then of course becomes that debilitating severe migraine. And then once you have that migraine, if it's treated or even sometimes if it's not treated, you tend to have that postdromal phase where the headache is not as intense, not as severe. You can still possibly have the headache, but you can feel exhausted, weak, tired, very confused, not yourself, not acting right. Fatigue is a very common symptom in that prodromal phase.
And we know there are different types of migraines. Do they all go through these stages?
Nope.
No
migraine is the same.
Oh.
So it really depends on the type of migraine that you have and some of the sequelae of symptoms that follow. So not everything, like I tell patients, 2 + 2 is not always 4 in medicine. So you're not always going to find the same
And they cannot
patient.
stand hearing
No,
that.
I know, I'm sorry, but it's the truth. It's not, medicine is not always as clear cut and not every patient is the same. So you have to treat symptoms a little different and they vary between patients.
Right. And even every patient is different too.
Absolutely.
So her migraine may not be your migraine.
Exactly.